Hi there, I'm Chelsea Serbinsky, a DNP FNP student at Weber State University, and today I'll be presenting on preconception and infertility counseling. So to guide our discussion today, we'll follow the journey of Jim and Pam, a fun-loving couple in their early 30s who have been trying to conceive for over a year without success. Like many couples, they feel both hopeful and a bit overwhelmed as they try to navigate this process. Using their story, we'll explore key aspects of preconception planning and the steps couples can take when conception doesn't happen as quickly as hoped. We're going to divide the discussion today into two parts. The first part will focus on the preconception journey, which includes preconception counseling, tracking ovulation, and understanding fertility patterns. And the second part will cover navigating infertility, so what a fertility workup involves, and the emotional and practical support that can help couples through this challenging experience. Let's start out by focusing on preconception counseling, the first step in preparing for a healthy pregnancy. Its purpose is to optimize health for both conception and pregnancy. For couples like Jim and Pam, preconception counseling includes reviewing medical history, current medications, and immunizations, as well as lifestyle factors such as diet, exercise, substance use, and mental health. Their reproductive goals are also discussed, along with any necessary screenings or referrals. Using a structured tool like the Reproductive Health National Training Center Preconception Counseling Checklist ensures that all key areas are addressed. The benefits are clear. Preconception counseling reduces pregnancy risks, increases the chance of conception, and supports overall maternal and fetal health. For Jim and Pam, following this checklist gives practical steps and reassurance as they move forward in their fertility journey. Here's a look at the RHNTC preconception checklist along with a link to access it. We'll be walking through each section of the checklist to show how it guides preconception counseling. The reproductive goals assessment includes the timing and intentions for pregnancy, any previous pregnancies, miscarriages, or complications, and exploring fertility concerns such as irregular cycles or prior evaluations. We also review contraceptive history and current use. For Jim and Pam, this helps us understand any factors that could affect their ability to conceive and ensures their counseling is personalized to their specific circumstances. In preconception counseling, a thorough medical history review is essential. Providers evaluate chronic conditions such as diabetes, hypertension, thyroid disorders, seizure disorders, and autoimmune or cardiovascular conditions, as these can affect fertility or pregnancy outcomes. Screening for infectious disease, including STIs, tuberculosis, hepatitis, and HIV, is also important. Medications are carefully reviewed, including prescription drugs like ACE inhibitors, isotretinoin or SSRIs, as well as over-the-counter medications, supplements, and fertility treatments to identify any that may pose risks. Immunizations are assessed and updated as needed to protect both the mother and future baby. Key vaccines include the Tdap, MMR, hepatitis B, varicella, influenza, and HPV. Live vaccines such as MMR, varicella, and the annual flu shot should ideally be given at least 30 days before conception. This step ensures that couples like Jim and Pam begin their pregnancy with optimal health and reduced risks. Lifestyle evaluation is a critical component of preconception counseling. Providers review diet and micronutrient intake, emphasizing folic acid 400 to 800 micrograms daily to prevent neural tube defects, iron, calcium, protein, as well as maintaining a healthy BMI between 18.5 and 24.9, since being under or overweight can reduce fertility and increase pregnancy risks. Exercise habits, sleep quality, and stress management are also important factors to consider. Substance use counseling is key. No amount of alcohol or tobacco is considered safe during pregnancy. Same goes for prescription drugs used for non-medical reasons and recreational or illegal drugs and excessive caffeine intake, as they can all negatively impact fertility and pregnancy outcomes. Mental health screening helps identify anxiety, depression, or high stress, and providers can encourage healthy coping strategies to support couples like Jim and Pam as they prepare for conception. Environmental exposures can impact fertility and pregnancy outcomes, so preconception counseling includes a review of potential risks in daily life. This may include chemicals, heavy metals, radiation, or other toxins encountered at home, work, or through hobbies. Occupational risks such as exposure to pesticides, solvents, or prolonged heat exposure should also be considered. It's equally important to assess psychosocial safety, including screening for partner or domestic violence, as stress and unsafe environments can affect overall health and fertility. Providers also assess access to needed resources like reliable transportation and social work support, which can help couples like Jim and Pam follow through on medical appointments and recommended interventions. By addressing these factors, couples can reduce risks and better prepare for healthy conception. A preconception checkup ensures the body is prepared for pregnancy and helps identify potential risks. Genetic and carrier screening, such as cystic fibrosis or Fragile X, provide insight into possible hereditary conditions. Blood work, including thyroid function, glucose, and folic acid levels, assess maternal health. Screening for infectious diseases like STIs, HIV, hepatitis, and tuberculosis is essential to prevent pregnancy complications. Couples may also be referred to specialists, including genetic counselors for high-risk families, reproductive endocrinologists for fertility concerns, and mental health or nutrition professionals for additional support. Dental checkups are also recommended since untreated gum disease can actually increase the risk of preterm or low birth weight babies. Together, these steps help couples like Jim and Pam enter pregnancy with the best possible health outcomes. Timing and ovulation awareness are key for understanding fertility. Menstrual cycles typically range from 24 to 38 days, with ovulation occurring roughly 14 days before the next period in a standard 28-day cycle. The fertile window includes the 5 days leading up to and including ovulation. Couples can track ovulation using basal body temperature, cervical mucus monitoring, or the calendar method. Combining these methods, known as the symptothermal method, increases accuracy. Ovulation predictor kits, or OPKs, detect the LH surge that triggers ovulation, helping couples like Jim and Pam identify their most fertile days and maximize their chances of conception. What in the world is an ovulation predictor kit? I'm glad you asked. We'll talk about it in the next slide. So ovulation predictor kits, or OPKs, are tools that detect the surge in luteinizing hormone, also known as LH, that triggers ovulation, helping couples to identify their most fertile days in the cycle. OPKs are available in several forms, including urine test strips, midstream sticks, and digital devices. Testing typically begins a few days prior to the expected ovulation day, usually days 7 to 14 of the cycle. Testing should be done once daily, usually in the afternoon, for best accuracy. You should also plan on following the instructions on the package of your chosen test. For stick tests, when the test line is as dark as or darker than the control line, it means that ovulation is near. And for digital tests, they may display yes, no, or a smiley face, and some actually integrate with apps to indicate peak fertility. Using OPKs alongside other fertility tracking methods, such as the basal body temperature monitoring or cervical mucus observation, helps to improve their accuracy. This combination helps couples like Jim and Pam plan intercourse during their fertile window and maximize their chance of conception.
So let's go over how to use ovulation predictor kits. Keep in mind that different companies will have specific instructions, so it's really important to read the package insert to know exactly how to use the specific ovulation predictor kit that you're using. Let's start with a traditional LH strip. Ideally, you want to do this first thing in the morning when you wake up. You want to urinate in a cup, and with the urine sample, you're going to dip it up until underneath the point of the line on the strip. And you want to hold it in there usually for about 10 to 15 seconds, but once again, every company is going to have specific instructions, so follow what they tell you. Once you dip it in, you want to lie it flat. Usually when it's positive, you can expect that you will ovulate within 24 to 36 hours. There are also digital tests that you can use. Once again, you want to make sure that you are reading the package instructions on how to specifically use the one that you have. But generally, once you either dip it in the urine or you pee on the stick, then you're going to go ahead and insert it into the little digital machine, and usually it will either give you a happy face or a sad face, indicating whether or not you are having an LH surge.
For Jim and Pam, it's now been a full year of trying to conceive without success. Since Pam is in her early 30s, this is the point when guidelines recommend beginning a formal infertility evaluation. If she were older, between the ages of 35 and 40, we would have started after 6 months. And if she were over 40 or had known risk factors like endometriosis or irregular cycles, we'd actually recommend starting even sooner. And it's important to remember that infertility isn't just about the female partner. Both partners should be evaluated since male and female factors often overlap. Let's start by looking at a fertility evaluation for Pam. Since she's been trying to conceive for over a year, we first start by reviewing her menstrual cycles, past pregnancies, contraceptive use, pelvic infections, surgeries, and medications. A focused physical exam should include the thyroid, breast, and pelvic areas. Labs assess ovarian reserve and ovulation, including AMH, FSH with estradiol, and mid-luteal progesterone. We also screen for conditions like thyroid dysfunction, hyperprolactinemia, or PCOS that can impact fertility. Imaging, including a transvaginal ultrasound and hysterosalpingography, helps evaluate the uterus, ovaries, and fallopian tubes. Specifically, we're checking for patency. Common causes of infertility include ovulatory dysfunction, diminished ovarian reserve, uterine or tubal abnormalities, and obesity. Addressing lifestyle factors remains important to support fertility outcomes. Now let's focus on Jim. Male factor infertility contributes to about 40 to 50% of infertility cases, so it's essential to evaluate both partners. We begin with a detailed history covering reproductive and sexual function, any erectile or libido issues, childhood illnesses like mumps, previous surgeries, infections, and exposure to toxins or heat, lifestyle factors such as tobacco, alcohol, and cannabis use, as well as obesity should also be assessed. The physical exam looks at BMI, penile and testicular health, and checks for varicocele or absent vas deferens, which may prompt genetic testing. The first-line test is a semen analysis, which should be collected after 2 to 5 days of abstinence. If results are abnormal, further hormonal testing or a urology referral may be recommended, and you do actually need to have 2 abnormal samples to warrant that workup. For both Jim and Pam, this evaluation helps identifying underlying issues and guides treatment options from lifestyle changes and ovulation induction to assisted reproductive technologies such as IVF. For Jim and Pam, a year of trying to conceive without success signals that it's time for further evaluation. If any abnormal results appear, for example, issues with Pam's ovarian reserve or Jim's semen analysis, a reproductive endocrinologist or fertility specialist should be involved. Other situations include advanced maternal age, known uterine or tubal issues, or multiple failed attempts with simpler treatments like ovulation induction or intrauterine insemination. Bringing in a specialist helps guide advanced testing, treatments like IVF, and tailored strategies to maximize their chances of conception. While Jim and Pam may feel isolated in this struggle, they're actually part of a much larger community. Infertility is more common than many realize, and countless couples are navigating the same challenges. The World Health Organization estimates that about 1 in 6 adults worldwide will experience infertility at some point in their lives. This is a global issue that affects people of all backgrounds, regardless of income or location. After a year of trying without success, many couples feel stress, sadness, or even isolation. That's why it's important to recognize infertility as a common challenge. It highlights the need for accessible, high-quality care. Infertility can take a significant emotional toll, causing stress, sadness, and anxiety. Providing emotional support is a crucial component of fertility care. Couples like Jim and Pam may benefit from counseling or therapy, either individually or together, as well as fertility support groups such as those offered by Resolve. Patient education and coping strategies can also help manage stress and maintain well-being. Integrating emotional health with medical treatment not only supports mental wellness, but can also improve overall fertility outcomes. As we wrap up, let's tie together the key points of the fertility journey. Preconception counseling lays the foundation. It helps optimize health, review medical history, lifestyle factors, and reproductive goals for couples like Jim and Pam. Cycle tracking is an essential tool for understanding fertile windows, whether using basal body temperature, cervical mucus monitoring, ovulation predictor kits, or combining methods with the symptothermal approach. This knowledge helps couples time intercourse to maximize their chances of conception. Fertility assessment, including labs, imaging, and evaluating both partners, identifies potential barriers and guides next steps. When advanced care is needed, referral to a reproductive endocrinologist, genetic counselor, or other specialist ensures that couples receive the right expertise. Finally, emotional support is critical throughout this process. Counseling, support groups, and patient education help manage the stress, anxiety, and feelings of isolation that can accompany infertility. Integrating emotional care with medical treatment supports overall outcomes. For Jim and Pam, and for many couples, combining these strategies gives a clear roadmap, providing guidance, reassurance, and hope on their fertility journey. Thanks for joining me today. Here are the included references for the presentation, and please let me know if you have any questions.